This podcast is on a condition called urogenital atrophy. So that's a long word, and what it means is lack of estrogen, which commonly occurs at the time of the menopause, affecting the tissue quality in the vagina and the bladder. This is a really common condition. It affects about 80% of women, and the important thing is without treatment, this condition will become progressively worse. It doesn't just go away like other menopausal symptoms do. So there are lots of different symptoms, and not only is the vagina affected, as I said, the bladder is also affected because it comes from the same source during development when you're a fetus or you're in utero. So things like vaginal dryness and itching are very common symptoms of this condition. Also pain during sexual intercourse, and sex can become impossible. So if sex is painful, then think about this as a possible cause. So like I said, most women are menopausal women, but sometimes this can occur in young women if they're breastfeeding or in association with use of certain types of contraception. These are the signs that might be seen. The folds in the vagina go, and therefore there's much less ability for the tissues to stretch. Instead of the tissue allowing stretch, they tear, and bleeding can be a common presenting complaint. The vagina can become shorter. The entrance to the vagina becomes deficient, and the urethra, where the urine comes out, can become quite prominent. The bacteria inside the vagina change, and instead of them being healthy bacteria, there's an overgrowth of unhealthy bacteria, which all women have, but they're kept at bay normally by something called lactobacillus, which is one of the healthy bacteria. Therefore, women with this condition might develop a vaginal discharge, and it's not an infection like a sexually transmitted infection, it's an overgrowth of organisms which are there normally. Urinary tract infection is also a problem, as is urinary frequency or getting up at night to pass urine. So all of these things combine together to affect quality of life, not just of women, but also of men. And it's really important to think, have I got these symptoms? Because there are lots of different treatment options, and without thinking that you might have the condition, then you wouldn't understand that you would be eligible for any of the treatment options. These include non-hormonal treatments and hormonal treatments. Now, unlike HRT, some of these locally applied treatments, even the hormonal ones, can be used in women who have a diagnosis of breast cancer. So if you feel that the doctor or nurse that you're seeing is unsure, then ask to be referred on to a specialist clinic. So if we start with the non-hormonal treatments, lubricants and moisturizers are simple solutions which can improve the situation for many women. However, they're not always enough, and treatments can be added together. Yes is a product range which is available on prescription, both as a vaginal moisturizer and as a water-based lubricant. That can improve comfort during sex, but you may need the addition of vaginal estrogen. And this can be delivered as a tiny little pellet, or as a cream, or as a gel, or as a waxy pessary. So there's lots of different products now available to suit the individual's needs. And there are some newer hormonal treatments. One is called prasterone. That's a little tablet which goes into the vagina, and that gets converted into estrogen and testosterone in the vaginal mucosa. And we think that testosterone is also very important, but there are no other locally applied testosterone treatments. And then there's ospemifene, which is taken by mouth, and that's a selective estrogen receptor modulator which improves vaginal tissue without affecting the breast or the lining of the womb. And finally, laser is available in the private sector, And whilst it's expensive, it's important, I think, for the most severely affected women to be aware of this treatment, which many clinicians are hoping will become available on the NHS in the future. So I think if you're listening to this podcast and you're thinking to yourself, actually, I've got pain when we try to have sex, or we haven't had sex for 3 or 4 years because the pain is too severe, then think about seeing your GP, practice nurse, pharmacist. If that doesn't work out for you, ask for a referral to a specialist service to enable you to have a conversation with someone about the treatment which would suit you best. So I hope I've given you something to think about in this podcast, and we'll meet again soon.